All right. Welcome to this next module. This one's going to be covering physical agent modalities or PAMS, more specifically relevant to upper extremity and hand therapy. This one's going to be just a little disclaimer, a little bit shorter, just because I felt that in education this is kind of taught pretty well. So kind of more of a refresher more than anything. I'll link some other useful links in the module if you want some further instruction or just kind of want to dive a little deeper, kind of get into a rabbit hole, if you may. So here we're going to cover just three basic components. So heat and cold, so thermotherapy and cryotherapy. So paraffin wax, hot packs, cold packs, ice massage, etc. Electrotherapeutic modalities, which might be the ones that we might feel most difficult like using in practice, especially when it comes to using it only a couple times in the lab and then having a patient in front of you and having to do it with a patient who genuinely needs it or could benefit from it. And then lastly, ultrasound, therapeutic ultrasound. Mhm. So for the first one, we're going to talk about heat and cold, so thermotherapy and cryotherapy. So pretty straightforward heat. So it's the application of superficial or deep heat to increase blood flow, reduce stiffness, and relieve pain. It's commonly used to improve tissue elasticity and facilitate movement before therapeutic exercise activity or manual therapy. You'll find that with your patients within a hand therapy clinic, this might be their favorite part of the therapy. It's definitely the most physically relaxing when you're applying heat to that affected area. It just kind of just again tissue extensibility allows them to perform more movement afterwards and perhaps even less painful movement as well. So it's very, very useful and beneficial to use prior to activity. But I will say that when, let's say, it's an evaluation day or you're reassessing the patient on their like measurements for like goniometer or grip strengthening, it's best to do this afterwards because you don't want this to affect the results and affect your charting when it comes to watching their progress. Because if you apply heat, most of the time you'll see that there's improved range of motion. So you want to get the assessment values based on how they come into you that day. So just kind of a little caveat there. Cold or cryotherapy, so applying cold to the hand or upper extremity to reduce inflammation, numb pain, and decrease metabolic activity in injured tissues. So this is especially useful in managing acute injuries, post-surgical swelling, and flare-ups of chronic conditions to control pain and limit tissue damage. I feel like, yeah, that one's kind of a straightforward one. Typically, with you use it oftentimes with patients who recently just underwent surgery, and you're kind of help trying to like combat that inflammation during that beginning phases of healing of the tissue healing there. But you also can rotate between the two. So coming into here, so with heat and thermotherapy, very beneficial again, decrease tissue tightness, decrease joint stiffness, provide pain relief, increase blood flow, facilitate tissue healing. But the contraindications for this would be you'd kind of want to avoid it within the first 24 to 48 hours after injury. In the early modules, I have a great piece of literature that kind of goes into why based on the stages of healing for tissue. You shouldn't be using it on patients with impaired sensation. So if you feel that they're at a condition or at a point where they might not be able to fully know if the heat is burning them, it's not something you might want to be using for them, especially if they're doing it at home. At least when you're doing it within the therapy clinic, you can put more attention to it and monitor the affected site. You wouldn't want to apply it over any open wounds or any malignancy in treatment areas. And these are things that you would see hopefully within their notes when they come to you. So forms of heat or thermotherapy, some of the most common ones being hot packs, paraffin wax, warm water immersion. So hot packs, they're also known as moist hot packs. Essentially a bit of like a towel or sleeve wrapped around a pack that are hot, really useful to apply to larger areas such as like the forearm or the shoulder. You could just kind of wrap this over their shoulder or like over their elbow, just kind of drape it over for like 5 minutes. Really good for larger spaces. Paraffin wax, it's a mixture of paraffin wax and mineral oil, I believe. and it provides an even coating of heat, and it's really good for like deep heat and great for covering like small little crevices. So like in the picture, you see the person immersing their hand. It's really easy to kind of like with finger injuries, hand injuries, to kind of dip it in there, pull it out, get like the desired level of thickness of paraffin, wrap it with like a baggie, and then just let the heating do the work there. And it's a bit messy. It can be a bit messy, but essentially it can be satisfying as well, peeling it off of their hand and tossing it in the garbage. But warm water immersion is one that I would like to note that would be useful for patients who might not have access to these at home. It's a good way to be able, while they're performing their HEP, to simulate what they're doing in therapy and like prepping themselves to perform activity. So they can get like a bowl of like hot or warm water, depending on what their tolerance is. And if you feel that it's necessary, you can kind of practice with them in the clinic to make sure that they're not pouring too hot of water for them. But the soaking in warm water essentially can help improve the circulation and tissue flexibility, useful for both the wrist, the hand, the fingers, and it's something, again, that they can do at home, and it's very inexpensive. So cold and cryotherapy. So the benefits of this, again, minimizing inflammation and swelling, controlling acute injuries or post-surgical responses to reduce the immediate inflammatory reaction, and then also limit secondary tissue damage. So it kind of slows cellular metabolism there. But the contraindications for this one, again, hypersensitivity or intolerance and impaired sensation. So if they can't feel that they're getting their extremity that's being affected is getting too cold, that can be a problem. So you'll definitely take this with a grain of salt, based on the patient that you're seeing. Um, oh, and you shouldn't do it over any open wounds or areas that have compromised skin integrity. And then also anybody with impaired circulation. And here's some of these examples where that might be the case. Um, but just some things to look out for. And again, that should be in your charting. So the forms of this, ice massage, cold packs, ice baths. You in the therapy clinic, I feel like most of the time you'll probably see these Dixie cups with little uh like frozen water inside of it, ice, I suppose. And you can just kind of massage the affected area using that. You could also use ice packs that are specific for this area, and you can have some that are larger, smaller. Do the same thing you did with the heat pack, be able to drape them over larger parts of the body. And then also, again, ice baths, similar to the warm water soaking for their hands and wrists. You can do the same thing with ice water. But again, take that with a grain of salt, go over it with your patient if you feel that it's needed, and then proceed from there. So the next we have the electrotherapeutic therapies. So essentially, FES, what is it? Functional electrical stimulation. It's a mouthful, but it is the utilization of electrical impulses to activate targeted muscles and nerves. So essentially, this device or these devices can produce muscle contractions through nerve stimulation, and they're used in aid to the production of functional and desired movement specifically. And I really want to emphasize the functional and desired movement aspect of this. There should be a module, literature, like a research article linked in this module where it kind of goes over essentially the benefits of attempting to perform a functional or desired movement at the same time as we're delivering these electrical stimulations, as it has really great benefits for them to kind of like, for let's say for patients with like stroke, for example, to sort of like link their brain and their actions along with this nerve. We're not necessarily just frying these nerves and just causing movements out of the blue for no reason. We're essentially that desired function, and the attempt of performing functional movement is really great for like a neuroplastic standpoint. But for this, contraindications, patients with pacemakers or implanted electrical devices, you don't want to do it over or near any malignancies. You don't want to do it over any open wounds or over any areas with metal implants either. Mm. And so what does it look like? Again, function is the focus. So using the electrical discharges to assist in performing volitional and functional movements. Um, Using these controlled electrical discharges to elicit responses in excitable cells, so neurons specifically, and assist in generating physical movement that can aid in increasing motor skills through a functional lens. Um, You would also want to keep note that you would like to use the least needed electrical stimulation when performing movements. Essentially, you don't want to go maxing out the machine. You want to find that sweet spot, that just right spot, where you're giving them just enough to perform it, but they're also putting in the effort. And then eventually you'll find that you can start decreasing the electrical stimulations if all goes well, and then they're performing more of these volitional movements on their own. So here in this instance, you can do fine motor versus gross motor. Gross motor, a little bit easier depending on like the little pads that you have. Fine motor can be a little tricky when you're thinking about stimulating some of those muscles within like in the hands, like those intrinsic muscles. Super tiny, they're all next to each other, so it's going to take a lot of trialing and cutting and just seeing what works and probably testing it on your clinical instructor or fellow colleagues, but essentially stimulating those small muscles of the hand produce fine motor movements such as grasping, releasing, pressing buttons, finger extension, etc. It's tricky, I will say, but it is possible. And then gross motor, so stimulating the larger muscles to produce larger movements such as like reaching, waving, or using even the upper extremity as a stabilizer or an assist when performing ADLs and IDLs, depending on which setting you're working in, can be very useful. Um, And then here we have TENS, so transcutaneous electrical nerve stimulation. So what is it? It's the use of low voltage electrical currents to stimulate sensory nerves to help reduce pain by interfering with pain signals and promoting endorphin release. Um, the contraindications for this one, again, very similar to the last when you're dealing with electricity. Patients with pacemakers, over implanted electrical devices, over near malignancies, wounds, and metal implants. Now let's take a look at what this looks like. Similar machine, sometimes be the same exact machine. There's different settings you can toggle between. I suggest you get familiar when you get into your hand therapy clinic. If you feel comfortable enough in using this, familiarize yourself with the units that they have available, as they might be a little different from the ones you have in school. But essentially, the electrodes are placed to stimulate muscle and nerve groups that are causing the patient pain, typically used for patients who are experiencing pain. It alleviates pain for some, not all. And then you can assess the use of the intensity, the frequency, and the duration. You can adjust all of these things during treatment. Um, and it can be very useful for patients when it comes to performing movement with feeling less pain. And then last little section here is therapeutic ultrasound. And a little spoiler, it's another form of heat, even though it doesn't necessarily look like one. The science behind it, pretty crazy. The vibrating crystal on the inside. If you're familiar with it, amazing. If not, feel free to dive into the rabbit hole of how this machine works. It's very interesting, but I will refrain from going into it. But essentially, what it is, it's the use of sound waves that penetrate into deep, soft tissues, which is useful in applying deep heat for patients. So it can improve circulation, increase tissue extensibility, and promote healing as well, very similar to all the other heating options. However, this is a really great way to perform deep heat and kind of get into those deeper muscles. Um, and it's really important to note that you want to keep constant movement when you're using this guy. You don't want to just kind of place it over one spot and leave it there, because you can get deep heat and kind of cause any potential burning, which would not be good. While some patients might state that they don't feel any difference, that's to them. You could use different forms of heat, but if you find that your patient does seem to like this is a great way to get sort of that deep heat, and the contraindications are very similar to these other ones, where you don't want to do these over areas with any malignancy, open wounds, or infected areas, over growth plates in children specifically, or areas with impaired sensation and circulation. And then let's take a look at what it looks like. Usually it will look like a big chunky unit like this. Some clinics will have things that are different, similar, some a little different or similar. On the image on the right, you can see that gray little knob is the sound head, essentially. They come in different sizes, so you can switch those out if they have it at your therapy clinic and use something smaller to perhaps get into different muscles within the hand, or use that one and you can use it around like the wrist. I've used it a lot for patients with carpal tunnel syndrome or De Quervain's, over kind of that first dorsal compartment. But essentially, you use ultrasound gel to improve the transmission of the sound waves, which is that little bottle on the right. And you can do it both at the beginning or end, or even both at the end of the treatment session for pain relief, increasing tissue extensibility, and that is also really great for decreasing scar tissue adherence. So if you find yourself with a patient who might have some adherence and it's interfering with their extensibility and like not allowing them for their tendons to glide the way that they're supposed to be, you could definitely use this guy to break up adherences and even promote greater range of motion in the clinic. But essentially, I'll have some more resources available about these if you would like to seek them. If not, if you feel very confident, feel free to glance over this module and move on. But there will be some really fun things to read and watch. So, yeah, thank you for listening, and I look forward to the next module.